Our next presentation is presented by Dr. Talha Rafeeqi, PGY4 surgery resident and research fellow at Stanford University. And the title is Long-Term Safety of Intraluminal Spring-Mediated Bowel Lengthening.
Thank you very much for having me here. I am honored to present our work here today. No, I can't see it. Oh, wait, there we go. There we go, all right. Before we begin, I'd like to disclose that Dr. James Dunn and Andre Bissett are co-founders of Eclipse Regenesis. This is a company that produces the spring-like intestinal lengthening devices that we are going to discuss today. So for a bit of background, we know that short bowel syndrome is a severe disease that leads to intestinal failure. The mainstay of treatment is parenteral nutrition, which has its own complications like line infections and liver failure. There are surgical intestinal lengthening options that exist, but these usually require the presence of dilated intestine. Our lab has been focusing on producing intraluminal springs that can achieve intestinal lengthening up to twofold in as little as 3 weeks without the need for dilated intestine. The purpose of this particular study was to explore the long-term safety of the Eclipse XL1 spring device prior to its use in human trials. So on the left here, you can see an example of the XL1 device, which basically is a spring that ranges from 10 to 12 millimeters in diameter based on bowel caliber and is compressed down to 2 centimeters and is designed to roughly double in length. These springs are placed into the jejunum in this experiment via a laparotomy and an enterotomy, and then they are fixed in place with plicating absorbable sutures on either side of the spring. Then we mark the spring segment as well as a separate internal control segment with non-absorbable suture, and then we additionally mark the spring segment with radiopaque clips so that we can follow them fluoroscopically. Pigs are then fed a liquid diet for 7 days postoperatively, after which they're transitioned to a regular diet. Their health is monitored with weekly weights, and fluoroscopic studies are used to monitor spring progression and lengthening or expansion every week as well. The pigs in this study were euthanized at 4 different time points at 30 days, 60 days, 90 days, and 180 days. And on necropsy, we observed changes in the spring segment length and compared that to changes in the internal controls. We also obtained samples for histopathologic analysis. So here you can see an example of our fluoroscopic studies. The fluoroscopic image on the left shows the spring on post-op day 0, just after deployment. And then by day 7, it has expanded to roughly 3.5 centimeters. The pigs did relatively well throughout this study. They gained an average of 88 grams per day. There were no leaks, perforations, or obstructions. However, 2 pigs did have early complications. One had an ileal interception, while the other had failure to thrive, and we weren't able to recognize the cause for that. Springs naturally passed out into the stool, mostly by 3 months, but all had passed out by 6 months. We did observe significant lengthening of the spring segment. When compared to internal controls, this was a lengthening by 72%, but when compared to initial length of the spring segment, they lengthened by 62% on average. What's important to note is that there was no significant difference in lengthening based on the time point. Here you can see H&E slides comparing the control segment to the spring segments. Note that by 180 days, the control and spring segments appear largely or very, very similar. We went further and we measured muscularis thickness, crypt depth, and villus length. We noted that muscularis thickness increased significantly across all time points. Crypt depth increased significantly at 60 and 90 days, and villus length increased significantly at 30, 60, and 90 days. The latter two had largely normalized by 180 days. So to conclude, we've again shown that intraluminal springs can achieve significant intestinal lengthening in as little as 3 weeks, and that with this study, we've seen that it persists for at least 6 months, and that at 6 months, these lengthening intestinal segments appear normal, or when compared to the controls. The devices, as we've seen before as well, pass spontaneously into the stool. There were some early complications, the 2 pigs that I mentioned earlier, and we need to keep these in mind as we monitor very closely during our human trials. An area of future study is to further study the function of the lengthened intestine with absorptive studies as well as neuroendocrine, enteroendocrine function as well. Thank you very much for your time and attention today.
I'm curious if you noticed any adhesions in the area of the bowel where the springs were placed and have subsequently passed at the time of necropsy.
Yeah, so depending on the age of the pig, we've seen adhesions more in the older pigs. And then usually by 6 months, the adhesions have decreased significantly. Yeah.
Hello, Brad Warner, St. Louis. Congratulations, that's great work and a continuation of a long-standing approach from Dr. Dunn in addressing, shortcut syndrome, and I really think this is really excellent. The things that I had a little concern about was that it was about a 3-centimeter length, which is significant relative to a control of 1.8, which was that just due to growth in the control? What was your control is one question, and the other is, with 3 centimeters, if their overall intestine length is 200 or so, how do you think 3 centimeters is really going to affect any functional changes or anything like that? You really have to probably couple it with a small bowel resection and then do the spring, or maybe multiple springs.
So thank you very much for those questions. They're excellent questions. The controls were the same length as the spring segments, that is 2 centimeters. These springs roughly expanded to 4.5 to 5 centimeters on this device. So that's why we saw a little less than doubling of length. In previous studies, though, we have used much longer springs, and we've seen a 2-fold to almost 3-fold lengthening effect. As far as the lengthening goes, we see that using more springs, or we've shown in previous studies that we can place multiple springs in continuity. Also, one other thing that we're studying further is re-lengthening previously lengthened intestine as well. And we've seen promising results with that.
All right, that's all the time we have for questions for this paper. Thank you.
Thank you very much.